Hello from the World Economic Forum in Geneva. My name is Adrian Monk. Welcome to this Africa media briefing with the WHO. Joining us from Brazzaville, Congo is Dr. Matshidiso Moeti, who is the Regional Director of the World Health Organization across Africa. Also joining us for this week are Dr. Amani Abu Zaid, who's Commissioner for Infrastructure and Energy at the African Union Commission, and she's joining from Cairo in Egypt. And also joining from Dakar, Senegal, we have Prosper Zoominto, who is Regional Director with the International Civil Aviation Organization. And as I'm sure you can guess from their roles, we'll be focusing on the impact of the pandemic on travel, tourism and movement across the continent. But before we move on to that, let's turn first for an update on the latest situation to Dr. Moeti in Brazzaville. Dr. Moeti.
Thank you very much, Adrian, and good afternoon to everyone. And thank you for having yet again joined us today. I'm very pleased to be joined today by Her Excellency Dr. Amani Abu Zaid, the African Union Commissioner for Infrastructure and Energy, and Mr. Prosper Zoominto, the Regional Director for West Africa of ICAO, to discuss the risks related to air travel and the mitigation strategies that countries and individuals can take to prevent the spread of COVID-19. Many governments have decided that travel needs to resume. And of course, we have seen that the closing down of travel has been a huge challenge to some of the work that has needed to be done, moving people, experts, and moving goods around countries. So this is a very important moment, we think, as well, which is why we thought this was a good theme for today's discussion. There are now more than 413,000 COVID-19 cases on the African continent, and sadly, more than 10,000 people have died. In the WHO African region, there are variations in how the epidemic is unfolding. There is community transmission in 30 out of our 47 countries. And then we also see that in countries like Benin and Malawi, case numbers are low, but are accelerating. In countries like Ghana and Nigeria, cases are steadily increasing. In Sierra Leone and Zambia, for instance, new cases are now decreasing. And we know that South Africa continues to be the worst affected country, accounting for almost 2/3 of the cumulative cases and for about half of the new cases in the past few days. As countries open up borders, WHO's advice is to make decisions and take action based on the data. So this requires strong surveillance systems, the case finding and testing to know where the virus is. Points of entry screening at land crossings has evolved into testing in some sub-regions we've seen, and occasionally led to long queues of vehicles and transport delays, and protocols have been developed to reduce this. So I think this tells us something about what might be necessary as far as the opening up now of air travel. Through preparedness for Ebola, temperature screening at airports is well established in the region. And we know that this has had an important contribution to make in identifying cases and also in enabling the tracing of their contacts once people have left the airport, because information was being collected of who was traveling and who was sitting where in a plane. Preliminary evidence on COVID-19 indicates that asymptomatic, pre-symptomatic, and mild cases play a significant role in transmission. So this means that follow-up of passengers for 14 days and strong contact tracing systems are incredibly important to identify imported cases as travel by air is opening up. Passenger information should be collected and managed quickly and systematically in collaboration with health authorities. And travelers need to know who to contact and what to do if they start to feel unwell. Surfaces like handrails and door handles should be frequently disinfected, and physical distancing should be encouraged by leaving seats vacant when possible and avoiding crowding people closely together. Our actions as individuals really make a difference. You may not feel ill. Other people may not look ill, but the virus may be there. By practicing physical distancing, hand hygiene, and wearing a mask over our mouths and noses, we can reduce the risk of transmission. Thanks to the public health and social measures that countries have put in place, we have not seen a sharp peak in cases in Africa. Going forward, everyone should prepare for this virus to continue to circulate for the foreseeable future. When restrictions are eased, cases may flare up, so every community must be able to find, test, isolate, and care for cases and trace and isolate their contacts. The risk can't be reduced to zero. We are constantly learning about this virus and what works in suppressing transmission. We will continue updating our guidance in line with the evidence. With data driving the response and everyone playing a role, we can limit the spread of COVID-19 and save lives. I very much look forward to our discussion today, and thank you again for having joined us.
Thank you very much, Dr. Moeti. Can I turn to Commissioner Abu Zaid and ask you, Commissioner, to give us an overview of how the pandemic has affected tourism and travel across the continent, and also perhaps what the African Union's recommendations are in respect of the travel and tourism situation?
First, thank you very much for inviting me to this very important panel. Important for our economy and for the livelihoods of many Africans. But also let me greet the distinguished panelists, my brother and my sister here present, because we have been working as a team globally and also regionally in Africa with the WHO, with ICAO, with the representatives of the airlines and the industry. So it is important that we have the different views, because we at the end of the day we are it's a common, it's a big issue and it's a common issue. It is big because tourism and travel in Africa, they are an important part of our economies. We're talking here about almost 10% of the GDP of Africa comes from tourism, and of course air travel is related to that. But also we have 24 million Africans, which means 24 million African families whose livelihood is linked to travel and tourism by way of employment, whether formal or informal. In some countries, by the way, the employment in tourism is almost 20%. And I must say that more than half of these jobs are women. So the impact is really severe, and some estimates, of course, I mean, things change. This is all very recent, and things keep changing. But we're talking here about almost $55 billion lost within 3 months for Africa in a year that was supposed to be where we were supposed to see, you know, an increase in travel and also air transport. So the blow is very hard between the economic losses, the job losses, and the livelihood losses that put also a strain on the environment, on the protection, you know, of wildlife, on rural communities. So all kinds of things that are happening, because tourism, as you know, it's a sector that permeates across so many sectors. So for us in Africa, tourism and travel, they are not luxury. This is our livelihood as well. Now, for the air transportation, particularly, and for airlines, of course, again, I mean, the losses. I mean, there's 95% revenue losses. Airlines so far lost about $8 billion, and in addition to so many other things, including, of course, salary reductions or layoffs, or, you know, the assets that are deteriorating, the issues regarding the maintenance, all kinds of things are happening. But also some of our airlines may not make it post-COVID. Remember, our airlines, some of them are nascent, and they were already in some difficulties economically, and their viability was also questioned even before COVID-19. So there are airlines that, as I said, may not survive COVID-19. What we're seeing also regarding airlines, some airlines like Ethiopian Airlines is using the opportunity to acquire smaller airlines, which is an excellent step. It's true that this, I mean, the pandemic had put a stop on African Union initiative for a single African air transport market, because we were engaged in in the recovery and restart of the sector. But also, I mean, the hope is that, knowing how things unfolded during the pandemic, this could also be in the midterm an opportunity for us to strengthen the intra-African air transport and promote it even further, even intra-African trade. Remember, the African Free Trade Area depends very much also on air travel, and with the supply chains, interrupted around the world, with now the focus on localizing more, on doing things, within a country or within a region or within the continent. I think this in the midterm could also boost or reinforce the need for the single African air transport market, and to vitalize the African Free Trade Area. Same thing for tourism. Now, as we gradually going to open or start to open since 2-3 days, of course, at the beginning it will be mainly business travels, domestic travel. International travel is going to be, a little slower, but we are also pushing now for intra-African tourism. We want to encourage this more. So we're encouraging also the lowering of taxes, the lowering of fees, of tickets, of visa facilitation, because again, I mean, this is an opportunity, I mean, to encourage Africans to see Africa and to travel across Africa. This could also help cushion some of the serious impacts on both air transport and tourism. That said, there is also some positive impacts. Since we talk about transportations in general and mobility in general, there are, the clearer air and the cleaner air, and also the fatalities on the roads. I mean, the fact that mobility stopped on the roads helped Africa, saved Africa some of the very high number of lives lost on tarmac. Africa loses or lost last year 292,000 lives in road accidents. This is the highest in the world. The numbers compared to last year over the same period dropped by 70%. So we saved lives also during this the lockdown and the confinement time. As I said, the midterm, there are some positive signs, to increase intra-African trade, transport, tourism, and other initiatives as well.
Right. Commissioner, thank you very much for that very broad overview of the situation. You mentioned airlines and air travel, and I want to turn, if I can, to Prosper Zohominto'o, who is with the International Civil Aviation Organization. Also on the line, we have Dr. Michel Yao, and particulièrement pour nos auditeurs en français, we'll be talking to him a little later in this briefing. But Mr. Zohominto'o, can you just tell us a little bit about the impact on air travel, both within countries and within the continent, and just how big a reduction there's been because of this pandemic?
Thank you very much, Mr. Mark, and thanks for the opportunity. I want first to greet my sisters, Dr. Moeti from WHO, and Dr. Abu Zaid, the Commissioner of the African Union Commission. And I really appreciate our collaboration in addressing these big challenges that is the COVID-19. As you are asking for the impact, we have really figures that are alarming for the air transport. We have, in terms of aircraft movement, we are talking of loss of 60%, including international traffic and domestic traffic. when it comes to passenger, we are talking of 60 million passengers less for international traffic, and around 30 million less for domestic traffic, Africa-wide. And in terms of the money, we are in the order of 13 billion US dollars, as the commissioner mentioned, and we are around 3 billion for domestic traffic. So we know addressing and mitigating the effect of COVID-19 has led states to take mitigation measures, of which restriction of travel, which in fact led to that situation I just described in figures that are the estimates of our economists in ICAO. ICAO took immediate and coordinated measures as soon as the pandemic was declared by WHO in 11th of March this year. And we started working with WHO and industry to see how first we take care of public health measures, how we put in place operational measures to continue supporting the flights, humanitarian flights, repatriation flights, emergency flight, and maintain the supply chain, which the commissioner was referring to, because it was vital to ensure that. And in the face of the various challenges confronting society and international aviation, ICAO listened to the industry and set up through its council a task force, that is the ICAO Council Aviation Recovery Task Force, involving all the stakeholders of the industry to develop clear guidance that will be global to ensure that the mitigation measures are properly harmonized. And one of the key elements was a recommendation from an ICAO program, that is the collaborative arrangement for the prevention and management of public health events. In aviation, we call it CAPSTA. That was established in 2006. And when it comes to the severe acute respiratory syndrome, SARS, and that body gathers resources from public and private sector. Its networks linked ICAO, WHO, other international organizations of the United Nations, civil aviation authorities, and public health at global, regional, and also national level. So the main recommendation I was referring to is the public health corridor. Mm-hmm. So the concept of the public health corridor aims at securing the path that the passengers or the cargo would take until boarding an aircraft and until arriving on boarding the aircraft at arrival. There are four main components. You have the aircraft that has to be secured. You have the crew that have to be secured, secured in terms of having due licenses that are valid, assuming they meet the medical fitness that go with the licensing. The same goes for the engineers taking care of the maintenance. The same goes for the air traffic controllers managing the aircraft in the airspace. And then you have the airports. That's also
it's a huge challenge that you're outlining there. I think I know that we've got a lot of journalists on the line who'd love to probably ask you in greater detail about some of those issues that you're outlining, Mr. Zo'o Minto'o. So I'm going to see if we can start that process with Linda Ensor from Business Day South Africa. Linda, if you can unmute yourself and put your question, please.
Yes, good afternoon. I'd like to ask Ms. Abu Zaid, which airlines were struggling before COVID and are likely to not survive? If she could give us some names of that. And does she think that one of the consequences of COVID or the pandemic is going to be a consolidation of airlines and perhaps greater dominance by big airlines such as Ethiopian, Emirates in Africa? Thank you.
Thanks for that.
Well, for example, since from your South Africa, I mean, your company, I mean, in South Africa had difficulties even before COVID-19. Smaller airlines definitely, because most of our airlines also are public, and many of them are not really, their finances were not good before the COVID-19. Our governments tried through the stimulus packages, you know, to support the airlines, I mean, and also to preserve the jobs, but there's so much the governments can do from public budget. Remember, I mean, the pressure, because all sectors practically, you know, fell apart, and so the stimulus packages would not be enough for everything. So yeah, I know that South Africa Airlines, I mean, the government said it clearly that they were not going to continue doing that. As I said, these are difficult times for our governments for all sectors. Now, maybe the airlines have the advantage of being service oriented. So luckily or hopefully, with the resumption of services, they can, you know, recover some of the revenues even slowly. This is not necessarily true for other sectors like health, where now all the attention is going to health, and rightly so. Acquiring, you know, it's a good move, I think. Yes, why not? I mean, we would like to see in Africa giant airlines that are strong, that are financially viable, and also to see the private sector get into this market, even if in smaller companies working in the nationally or the sub-region. That would be great, and that's what also the SATAM, the Single African Air Transport Market, is about. I'm not talking about Emirates. No, I hope that our African airlines will see more consolidation of African airlines, giant airlines, financially and business-wise viable and strong, and to see also the private sector get into this market because it promises to be a very large market, especially upon the operationalization of the African Free Trade Area.
Thank you, Commissioner. Just want to bring in Irene Ubani from Plus TV Africa in Nigeria. Irene, if you're on the line, can we just hear from you? We just need you to unmute yourself, Irene, if you could.
Warm greetings. Correction, formerly Plus TV Africa. Can you hear me?
Yes, we can hear you.
All right. I formerly used to be at Plus TV Africa. My question, bearing the impact of COVID-19, what new innovations should be expected? And most importantly, what strategies are being set in place to ensure the safety of commuters during cross-border travel?
Thanks for that, Irene. And perhaps we can turn to Mr. Zoe Minto, who was talking about the public health corridor concept. Maybe you could tell us a little bit more about what measures are being put in place for people and travel.
Yeah, thank you.
I would like to have a quick innovation.
Sorry? Can I?
Go ahead.
Yes, I understood the question, and it is true that it is one of the issues, if not the main issue, that we are trying to address through the concept of public health corridors. And I was mentioning the various components that include the aircraft, the crew, the airports, cargo, that is all the pass that is taken by all the people who board an aircraft. So,
are there examples, Mr. Zoaminto, that you can give us of places where those public health corridors have been instituted?
What I was saying earlier is that we have the ICAO Council that established a task force. The task force has issued its report recently, that is early June. And that report contained a set of recommendations, of which we have aviation public-related measures. So this recommendation has been now disseminated to the whole world, and even I was thanking the commissioner because she was a member of the task force, and at the African Union level, the recommendation of the CART, that report, have been endorsed, and that now leads us to accompany the states in implementing these measures. They are recent measures, and we are pushing because now states are preparing to reopen the airspace. So they have been translating in regulations. Industry has endorsed. They were involved in the process. They own the process and started preparing for this to implement, I mean, at the level of each stakeholder.
Thank you very much. Commissioner, perhaps you can give some examples of where we might see those measures first implemented.
Actually, I wanted to address the issue of innovation, and I liked very much that the one who asked this question is a young person, and rightly so, because these times we are living the digital age as it should, or as we were expecting it to happen in 5 or 10 years old. From now, forward. So one of the very important things that we should also understand and start doing here in Africa that I'm really happy to see have started already is digital means and innovation through digitalization. We're seeing more virtual tours online. We're seeing more of our countries using the social media to show some parts of our beaches or the kind of culinary experiences that could be expected in this or that country. We've seen young people using applications that also helps with different ways of doing tourism or travel or trekking and so on and so forth. These have to be encouraged because this is also a time where we should invest in digitalization, and digitalization in especially in sectors like tourism could be very, very promising. And it started already happening on the continent as it started, and we've seen that happening in Europe as well.
Thanks so much, Commissioner. I just for a moment want to bring in Dr. Michel Yao. Dr. Yao, pour nos auditeurs en français, est-ce que c'est possible de donner un sommaire des nouvelles en français, peut-être? Et vous...
Merci beaucoup. J'essaie de remettre le son. Donc, la situation dans la région africaine est évolutive. La situation dépend des pays. Pour toute l'Afrique, nous avons une augmentation, notamment au niveau de l'Afrique du Sud, qui de façon cumulative constitue pratiquement les 2/3 du nombre en Afrique. Et dans les dernières 2 semaines, le nombre en Afrique du Sud constitue presque la moitié des cas. Et nous avons aussi, au niveau de la région africaine, un certain relâchement des mesures de confinement. Et nous avons observé que dans certains pays, ces relâchements s'accompagnent d'une augmentation de cas. Et donc, l'OMS insiste sur le fait que ces relâchements doivent être basés sur des évidences, notamment un système de surveillance assez solide avec l'application stricte des mesures barrières. notamment les mesures pour prévenir la propagation, y compris le port de masques, surtout dans les conditions, dans les contextes où on a une transmission communautaire et surtout dans les contextes de haute promiscuité et de haute densité de population, notamment dans les transports publics et les lieux hautement achalandés comme les marchés. Il faut aussi s'assurer qu'on améliore les capacités de tests pour pouvoir voir l'ampleur exacte de l'épidémie et qu'on mette en place aussi la capacité pour la prise en charge et que cette capacité-là aussi soit décentralisée à travers le pays, non seulement dans les grandes villes, mais à travers tout le pays, et ceci pour assurer une certaine continuité de service qu'on ne peut pas se permettre dans le contexte africain de suspendre, notamment la vaccination et d'autres services urgents pour les populations, en tenant aussi compte des mesures d'accompagnement qui vont nettement au-delà des aspects de santé. Donc voici plus ou moins résumé la situation en Afrique. Il y a quelques pays qui alimentent en termes de nombre de cas l'épidémie, mais la tendance est à la hausse et il faut rester prudent.
Merci beaucoup, Dr. Yao. I want to turn to David Andelman, if I can, from CNN Opinion. David.
Yes, thank you. Can you hear me well?
We can.
Excellent. So I'm interested in going a little bit broadly, but beyond the pure travel issue, and if you have a sense of how much hidden coronavirus there is right now in Africa, beyond even the immediate statistics, which are quite modest by global standards, it would seem. And could this eventually seed a wave, a third wave beyond Africa, even in Europe or the US, as it did apparently the influenza pandemic 100 years ago? Thank you.
Thanks very much. Perhaps I can turn to Dr. Moeti to answer that question.
Yes, thank you very much. I mean, we think that there is no doubt that due to the capacity gaps in testing in African countries, if we go back to the start of this pandemic, there were only 2 countries that were capable of diagnosing this virus. All the countries are now able to do this, but much of the capacity is still concentrated in the capital cities. There are some countries that have started to get laboratory capacity out to the district, to the more local level. And then secondly, there's been a tremendous problem, a real crisis of access to the material with which to carry out this testing, particularly the test kits or cartridges as relates to the GeneXpert platform for carrying out this test. So there's no doubt that the majority of African countries are testing less per capita than we are seeing in some of the other parts of the world where the pandemic started and where these materials are more readily available. However, we've seen when countries have increased their testing, so certainly in South Africa, they increased their testing at the same time as the pandemic, the epidemic was transitioning out into the general population, into low-income groups, and that's what we've seen in places like the Western Cape, in Gauteng, the hotspots in South Africa. We've seen in certain countries that when they do increase their testing, they detect more cases. In Ethiopia, for example, they've decentralized and scaled up their testing capacity, and we have seen the number of cases per day increase. On the other hand, there are some countries, and one of them is Senegal, who developed their own test, who scaled up their testing. And we have seen here that apart from where there are hotspots, like in the capital city, where they have tested more broadly, we have not seen an increase in the proportion of those who are tested, who are positive. So what we are concluding is first to acknowledge that there is a certain level of underestimation of testing. Most African countries are testing people who are presenting with symptoms and are encouraging people to come with early symptoms. A certain number of countries like South Africa, for one, Ghana, Gabon, Ethiopia have gone out into the community to test more people who are asymptomatic and picked up more cases. So we think that there is a certain underestimation of cases. We are working with the countries in terms of surveillance, and I have to acknowledge that the influenza surveillance that we had is not working very well at the moment because much of the capacity there is working for the COVID-19 response. So we conclude that there is a certain degree and I cannot quantify it, of underestimation of the number of cases. But we do not think that there are there's a multiple-fold number of cases which are undetected and people are dying unknown of COVID-19 in African countries. So I think this is the best I can say. At the same time, we are working very hard with the African Union, the Africa CDC, with our global partners to move to have better testing capacity in African countries and to help them use some of the newer rapid diagnostic tests so that they can carry out surveillance and be able to be better informed of where the virus may be circulating.
Okay, perhaps I can ask the Commissioner to come in on that.
Yes, I mean, of course, I mean, my sister here spoke, I mean, from a position of knowledge and science, but we do have to acknowledge that all African countries, almost without exception, from day one of the declaration of the pandemic, took very rigorous and very serious measures of containment, of confinement. We followed, all our countries followed to the letter the recommendations of the WHO, of health services, of science, and we applied them and we try out, even though our countries, I mean, as I said earlier in my intervention, this is seriously affecting the livelihoods, not just the lives, but the livelihoods of Africans. But our countries and our leaders were very strict and very rigorous in implementing the measures. Another aspect also is the solidarity. Africa came together as one. In the very first week, our leaders met together, and there's a special task force that was set. A fund was set also, a post-COVID-19 fund to deal with the impacts. Our countries are helping each other in terms of supplies, of medical supplies. Our airlines are, despite the difficulties, are delivering these supplies. Ethiopian Airlines, Egypt Air, Air Morocco, Cameroon. So we've seen and continue to see a strong solidarity at all levels in Africa, and also full confidence in our CDC and in the public measures that have been implemented. So one must also acknowledge the great example that Africa has set during a very serious global pandemic.
Thanks for that, Commissioner. Can we just take a couple of questions now? Kara Anna from AP in South Africa, and then Nyalaziri Manzuru from iMedia in South Sudan. If we can go to Kara and then Nyalaziri.
Hi, yes, thanks for this. Dr. Moeti, you just mentioned a crisis of access to testing materials. So which countries outside Africa are buying up the supply? And then also on the topic of travel, do you feel the return of international air travel is happening too soon as the pandemic grows rapidly here? Thank you.
Okay, and also Nyalaziri Manzuru, if we can get your question. Sorry, just being told that Nyalaziri has dropped off. Perhaps we can take Simon Ateba, who's in Washington. Simon.
Yeah, thank you for taking my question. My name is Simon Ateba from Today News Africa in Washington, D.C. The World Bank announced yesterday that it will be lending $50 billion to 48 countries in sub-Saharan Africa, and the IMF has already loaned $15 billion to almost 30 countries in sub-Saharan Africa, with Egypt, Nigeria, Ethiopia having the largest share of the loan. This loan can become really very expensive if they are not well invested. I was wondering to the African Union Commissioner, is there anything the Union is doing to engage all these multilateral lenders to either do more debt relief for African countries, or even engage partners like China to also step up a little bit?
Thanks, Simon. I'm going to turn first to Dr. Moeti just on Kara's question, or two questions, I should say. Dr. Moeti. Oh, we need you to unmute yourself, please, Doctor. Perfect. Thank you.
Okay. So thanks for that question. It's not possible for me to say which countries are buying up the supply. I think generally the global market became very distorted on some of these key items, not only, so on the equipment, first of all, we worked with partners to obtain some for countries, and on the test kits. Certainly we've seen some countries that are producing some of these items also prohibit their exportation. And so it's really been a matter of working as a coalition. WHO has worked with some of the partners in the UN and some of the foundations that are supporting African countries or supporting countries globally to establish a coalition where we've pooled our resources and are then working with the producers of some of these items to be able to secure some of the supplies. I know very well that the African Union is also working with a conglomerate of African partners to work to secure the supply for African countries. But I mean, it's generally the better off countries that are larger, that are able to secure, to put in quite large amounts of orders. Presumably this is more interesting to the producers then. Certainly we have a distorted global market, which speaks really to the need for some principles of equity and of global solidarity if we're to solve this collective problem. Because as long as the virus is circulating on one continent or in one country, the rest are also at risk. And then the second question on is travel opening up too soon? I mean, I think countries have had to face this dilemma of balancing up the needs of controlling a pandemic with the huge impact, the Commissioner has already said, on livelihoods and on economies. So it is, what is important, in my view, is to use data to determine the degree to which this travel can start, and of course to guide the conditions, it was being said by my colleague from ICAO, to guide the conditions under which this travel happens in order to minimize the risk. So I think that this is a very important component in allowing travel. We've started for several months now trying to work on humanitarian corridors to enable our experts to move around people we needed to help countries. And they've had to follow certain procedures in order to minimize the risk of people who are infected coming into countries carrying the virus. And we think the same principles should apply for business-related travel, even tourism, which, as we said, we heard is very important for economies in our countries. And I think it is possible to use data and information to guide some of this, to manage the risk. And when we start to see a flare-up that is unacceptable, then to possibly reverse some of the decisions related to travel. All of this needs juggling and managing on a day-to-day basis using evidence and well-tried intervention strategies.
Thank you, Dr. Martin. Commissioner, you may want to come in on that question, but also perhaps take the question on debt relief and the African Union work on that.
Yes, as I said, you know, the African Union, the presidency of the African Union and the office of the presidency of the African Union, composed of 5 heads of states, appointed special envoys to discuss with donor countries and institutions regarding the debt relief and the debt forgiveness of Africa during this time. And we've seen already some positive signs, including China last 3 weeks ago, during a virtual meeting also with the heads of states, the forgiveness of some of the debts to Africa, and it is happening as we speak. Same thing with the financial institutions. The discussions are underway to see whether I'm not sure whether they can completely wipe off the debts, but at least cancel the interest or defer them. So discussions are underway and they are not final yet. But definitely the African Union, through its presidency and through the special envoys, this is the work that is being currently done, including China, even though China is not the largest part of Africa's debts.
Thank you very much, Commissioner. I want to take a couple of questions from Sho Beppu of NHK, Japanese broadcaster in South Africa. and also Michelle Pienaar. Michelle from the George Herald in South Africa. So Shobepu first, if we may.
Yes, hi. Thank you for the opportunity. Dr. Moeti, in South Africa, where I'm now based, we are expecting the peak to come in July and August, and we are indeed feeling that the storm is approaching. If the peak for South Africa is coming in the months of July and August, are there any projections of the peak in Africa as a continent as a whole? And my other question is probably to Madame Abuzaid, but which country in sub-Saharan Africa has in fact or is going to start international travels? Can I understand that Senegal could be the first case that is announcing to start in mid-July? Thank you.
Okay, thank you. And also Michelle Pienaar. Michelle, we have your question.
Hi, I would like to know if, in your experience, as seen with other countries, it is a good idea to open schools during the peak of COVID-19, as is happening at this moment with us.
Thanks, Michelle. Perhaps before we go to Dr. Moeti and the Commissioner for those answers, we actually have in Dakar, Senegal, Prosper Zoominto. And Prosper, perhaps you can just give us an update on will Senegal, to the best of your knowledge, be one of the first countries to open up its air space?
Thank you, Dr. Moon. I call you doctor. Sorry for that.
Don't worry, I'm actually a professor, but don't worry.
That's great. So very recently, the head of states of Senegal, President Macky Sall, addressed the nation and declared first the lifting of the state of emergency, the lifting of the curfew, and he announced that international flights will start on 15th of July, that is this month. Before that, there were already, like 2 weeks ago, some domestic flights between selected cities in Senegal with the national airlines.
Thank you for that. Thanks. Dr. Moeti, just coming back then to Shobepu's question about the peak for Africa as a whole, and perhaps also to Michelle's question on opening up of schools. Perhaps if you could take those two questions.
Mm-hmm. Yes, thank you very much. Well, I think that it's quite difficult to project a peak for a whole continent. The countries are so different in terms of the dynamic of the pandemic. We have our EPI team working now with a new model and tool, trying to see some short-term projections, and then after that, trying to look at when we could estimate a peak. And this is not something that I'm able to say now, but we are working on it. I mean, we think that what's important is to scale up the public health capacities to contain the pandemic as countries are opening up and allowing more movement of people, business, and opening up the economy, so that whatever happens in the way of flare-ups, countries have the capacity to intervene and try to stop them, and that the response is differentiated within countries, because even in a country, you don't get the same situation everywhere. Within countries, we have hotspots. There are places where it's important to sustain the measures while opening up in other places where the situation might not be so severe, in order to restart some of normal life. So just to say, at the moment, no, I'm not able to predict when the peak is coming. We have seen that there has been a gradual increase. So if we separate the data for South Africa and a couple of other countries which are having exponential growth at the moment, we see an increase certainly overall in the region, but a gradual increase. So a curve, a graph which is not very steep, which is relatively flat, but a continuing increase. And we suspect that this increase will continue even as the countries are improving their control measures, probably until the time when we are able to bring on board a more definitive intervention like a vaccine, which we're hoping very much will become available.
Thanks.
If I can, then the second question, essentially, it's to say that again, it's important, and we have observed the pressure for various reasons, economic reasons, the fact that children have been out of school. This has impacts beyond education in some societies. In some countries, we have find it's got ramifications then for children having access to other services that they obtain through the education system, especially kids from low-income families. Again, it's really a matter of managing the situation, ensuring that if you are going to open up, even as cases are increasing, the opening up is done in such a way that the risks are minimized. I'm aware that in South Africa, when the schools resumed last week, there were a certain number of schools where the cases appeared, and then those schools are being closed again. So again, there is need to monitor and to make decisions based on the local situation, whether children can start going back to school or not. Certainly, if a place is a hotspot in a country, one would have to be very, very detailed about the preparedness of the schools to be opened up safely and be ready to reverse such decisions if those measures were not adequate and cases still arise. So again, it's back to that same principle: use data to determine what happens. It may be necessary to do differentiated opening up. So in rural areas where the virus is not circulating very intensely, it may well be very reasonable to allow children to go back to school and other aspects of normal life to resume.
Thanks for that. Commissioner, I'm not sure if you want to come in on that issue.
I want to come in, I want to come in on the issue of the airlines. We have EgyptAir that started already, resumed its operations since July 1st to 27 destinations. And they said they shall continue doing that as well. By the way, they never stopped the domestic flights. South Africa Airlines, I mean, resumed since June 15th, domestic flights. Ethiopian Airlines and Kenya Airways, Ethiopian Airlines did not really stop, but reduced the traffic and the destinations, but they are going to add more also in July. Air Cote d'Ivoire, they have some domestic destinations. I mean, we're between here and I would say 1st of September, we'll see much more gradual increase in the number of airlines opening up and or the increase in the number of destinations.
Thanks very much, Commissioner. We have on the line, I think, Favor Omokai from Plus TV Nigeria. Favor, you have a question.
Okay, greetings from Nigeria. My question is directed to Dr. Amani Abozai. Let's talk about African countries that rely heavily on the tourism sector, the tourism industry, whereabouts, for example, South Africa, we have like about 9.2% of jobs that come from based on tourism. What recommendations would you give to those countries as to keeping a balanced economy at least post COVID-19? Thank you.
Thank you. Commissioner.
Am I still in?
Yes, yep, we hear you.
Actually, your question goes beyond just tourism. For countries relying on one source of revenue, I mean, here you talk about countries relying heavily on tourism, for instance, such as many of our island states. We have countries that rely heavily on oil revenues. So the reliance on one sector is not something that should continue. I mean, I think the big lesson we have learned, or the lessons, two things: diversification in the sources of income and revenues for a country. That's essential. Two is upgrade and innovation. You cannot keep doing things now or post COVID-19 as you've done them 3 months ago. And that's why I made earlier the comment regarding digitalization. And this goes to all sectors. So we must understand that this is the new norm, that the world is not going back. This is very important as well. Lesson two to understand. Third is also looking within us, looking for Africa. I mean, we have neglected, or that the share of African tourism, speaking of tourism, since it's your question, intra-African tourism is 2-3%. Africans do not even know their continent, and for reason, because there are restrictions on the visas, because traveling to Europe is very often cheaper than just going to the country, taking a flight to a country next door. We have to acknowledge that. So that is why we should also take a very serious and deep look on the fares, on the visas within Africa, and also to make sure that in our strategies, we do target African tourism for Africa. That's very important. And therefore, that's why we're having the single African air transport market to bring the prices down. We are working on the visa openness, and we see more of that happening, but now we need to accelerate that, and also the strategy for intra-African tourism. And we've got now, last week, we got a strong recommendation from the countries to expedite the implementation of a strategy for intra-African tourism.
Thank you very much. I have a question from Susan Njanji with AFP in South Africa. Susan.
Thank you so much. My question is directed to Mr. Minto. Would you have an idea of how much African airlines would require for them to take back to the skies, given that they've been grounded for all these months? Thank you.
Thanks for that. We've down to our last 3 minutes of our hour, so ask for a very brief estimate, Mr. Zominto.
Hello? Yeah, okay. Thank you for that question. Mr. Monk, the estimate will be just a very gross one. I refer to the work being done by the with the African Union Commission. We came up with a rough estimates of 20 billion. That is based on a few assumptions that needs to be obviously evaluated in time and updated. But this is very rough figure, which is in the report of the African Union Commission task force. Don't have a figure. Thank you.
Thanks for that. We're approaching the end of our hour-long briefing. I want to thank very much Her Excellency Commissioner Abu Zaid, Mr. Zominto for joining us from Senegal, Dr. Yao, and perhaps we just have time for a last summing up from Dr. Moeti in Brazzaville. Dr. Moeti.
Yes, thank you. I think this discussion has really illustrated the links between economies and this pandemic. And we've said often that in Africa, the economic impact started, in fact, was more severe than the health impact so far. So just to say, we are continuing, we would like to continue to work with our partners to keep advising the governments to juggle, balance these needs. And of course, air travel is vitally important for everything we do, including the public health work that we are supporting countries to carry out. So it can only be that we need to help to this opening up to happen and to happen safely for our economies, while at the same time we're controlling this pandemic. Thank you very much.
Thank you. Thanks to all our panelists once again, and thanks to all of you for joining us online and for your questions. From Geneva, have a good rest of your day. Thank you.